Hello, my name is Thomas Roth. We'll be discussing an interesting case scene of a sleep disorder in a primary care practice, and which is sort of resolved by an interaction between a primary care physician and a circadian rhythm sleep researcher. So I will be joined by Dr. Doghramji, who's a primary care physician. This is his patient. And Dr. Phyllis Zee, who's a neurologist and a sleep medicine clinician. And they sort of worked on this case together. So Paul, why don't you start the case for us?
Okay, well, this is a case, Tom, of a 47-year-old gentleman who comes to see me for his annual physical. And among other things, I ask him, of course, is there anything bothering you? I want to talk about something. He says, well, yeah, I want to talk to you about the fact that I go to Europe 6 times a year. And I stay there for about a day or two, Phyllis. And here's what he says to me. He says, I have a lot of trouble when I'm there because of sleep. I can't get to sleep. And then during the daytime, when I'm there, I'm really drowsy. I just don't feel well. So one of his friends gave him medication to take on the plane to help him sleep because it's a 6-hour flight. And then when he gets there, he continues to take the medication for sleep. And he starts the day with bright light. He tries to do all this kind of stuff. So it seemed like he knew a little bit about what to do. But the thing is, he wanted a little bit more information, Phyllis, because he still wasn't doing well. He still was kind of sleepy. He still, during the daytime, and he wasn't getting the right kind of sleep. He wanted to know, is there anything else I had to offer him? So what should I tell him?
Well, he's traveling east, right?
Yes, he's traveling east.
And so absolutely wrong thing to do is having that bright light in the morning. Okay. So he should actually, for the first 2 days or so after arriving in Europe, is to avoid bright light in the morning, probably until about noontime. And then in the afternoon, he can be exposed to bright light. And actually, that would be a very, very good time. During the morning, what he can do is just wear sunglasses, especially some of those amber color sunglasses. They actually filter out that blue light, which is the light that is more, the most potent light for the circadian system. Because getting that light in the early morning hours is actually going to help prevent him from his clock from adjusting to the new time zone.
Okay. So now he takes this, the red-eye flight in a sense. So as soon as he lands in Europe, he should try to wear these glasses.
Yes.
Okay.
So one of the things he's been focusing on is I got to get enough sleep on a plane. I got to get enough sleep at night, but his big problem is that he's falling asleep during his meetings during the day. And I think his theory, like most of us, is, well, if I get enough sleep, I can stay awake anywhere, anytime. Exactly. And is that true?
Well, it's a very important point, Tom, is that it's good to get more sleep and good quality sleep, but because the circadian rhythm is misaligned, where when he's at the meeting, his clock is saying, go to sleep, go to sleep. So despite getting adequate amount of sleep, one is very likely to still be sleepy during the day when they need to work.
Should I advise him to try to get sleep on the plane? Is that a good idea? Or should I even advise him try not to fly in the middle of the night?
No, it seems like it's working for him.
Okay.
He's taking something that's helping him sleep during the plane ride, and apparently seems like he's also getting adequate sleep in Europe with this medication. So I would continue with that. It's only just for a day or two, so I would continue with that. But in addition, just advise him not to be exposed to bright light in the early morning when in Europe. But also because he is very likely to continue to be sleepy during his meetings and during his work hours in Europe, one may want to consider a wake promoting agent.
Now, I also told him that he shouldn't be taking his friend's medication, so I prescribed that medication.
Good idea.
Myself and advised.
What was it anyways?
It was Zolpidem.
Okay.
Zolpidem, 10 milligrams. And of course, to make sure that when he takes it, that the medication is going to be on board for the next 5-6 hours to make sure that he's either in bed or sleeping during that time. We don't want him to be walking around in some European airport with some Zolpidem on board.
Agree.
So he comes back 6 months later and he says that he stopped exposing himself to bright light, and he's changing from morning to the afternoon, and now he's taking a wake enhancing medication. But here's what he says: I'm having some problems now, or I think I may have some problems, because next month I'm traveling with my spouse and I'm staying 2 weeks, not several days. So he asks, is there any specific thing that I should do differently at this point?
Well, because he's now on vacation,
Yes.
and if he or his spouse has the time before they actually embark on that plane for, let's say, 2 or 3 days, they can actually have what we call a pre-flight adjustment. They can actually go to bed a little bit earlier, by 1, 2 hours earlier, wake up earlier, and that actually will help them kind of advance their circadian rhythms in the right direction, if they can do that. Same thing, avoid bright light when they get to their new time zone in Europe. If they need to, if they can't fall asleep, which is most common, what's going to happen is they can't fall asleep, a short-acting hypnotic like the Zolpidem that you have prescribed for the husband, you may also want to consider that for his wife. And continue in the new time zone to avoid that bright light in the morning, get as much bright light as possible in the mid-afternoon, and then also exercise. I think keeping themselves active during the day is very important, and at all costs, avoid succumbing to sleeping and taking naps during the day in Europe, because that's going to decrease both of their abilities to actually fall asleep at night.
Is there any benefit in suggesting to him that on those several days prior, trying to change their sleep clock a little bit, to use some melatonin?
The studies actually have shown that you can use both bright light and melatonin. So what you want to do is advance their timing and sleep-wake cycle a little bit earlier, and you can have bright light in the morning between, let's say, 6 and 8 o'clock in the morning, and or melatonin in the early evening. So that's actually been used. Very low dose melatonin, and certainly this is an off-label indication. It's not approved by the FDA, but if you were going to recommend that, uses a very low dose melatonin.
Now they're going to be there 2 weeks. On the way back, is there anything specific he should remember about when he comes back, and to not have problems restarting when he returns?
It's a totally different problem when he gets back after 2 weeks. Now he has to move his clock in the opposite direction, and so they're going to have more difficulty, not so much falling asleep when they come back, but it's going to be trouble maintaining sleep, early morning awakening. Again, here you can actually get exposure to bright light in the morning, and that is perfectly fine when they come back to the United States. And then at the same time, the same idea is keep yourself active during the day. Do not succumb to sleeping at the wrong time of the day, exercising. And if needed, for the first couple days, the same thing. Maybe a sleep-promoting agent to help them maintain their sleep, and or, if needed, depending on what activities they need for safety reasons or for performance reasons, a wake-promoting agent for a couple days.
Okay.
And I want to thank you both. I think this is just an amazing, really, really interesting case, and I think it sort of teaches us, the audience, myself, that when you have circadian rhythm disorders, jet lag, shift work, things like that, there are 3 therapeutic targets, and you both spoke about all 3 of those. You talk about fixing their sleep, you talk about fixing their daytime alertness, and you talk about moving their clock. So you have 3 targets. You talk about light and melatonin for shifting clocks, you talk about wake-enhancing drugs for daytime, you talk about sleep medications for nighttime. Thank you very much for this great case.